The business value of VistA. Evaluating the business potential of information technologies is important because it helps to determine the relationship between IT investment and future organizational revenue, thus demonstrating the impact of technology on the business revenues, expenses, and bottom line. In regards to the field of healthcare, it is important to estimate the relative value of VistA for the Department of Veterans Affairs, Veterans Health Administration, or VHA, to help understand VistA's impact on the financial viability of the VHA. Thus, this project examines the business value of VistA, the VHA's information technology system. However, before we begin the analysis, let's learn more about the VHA and VistA. The VHA is a health services branch of the Department of Veterans Affairs, and it operates one of the largest health services systems in the U.S. In 2005, the VHA provided care for more than 5.3 million patients. There are 1,300 sites of care, including 154 medical centers and 875 outpatient clinics. With a budget of $1.7 billion, the VHA is a world leader in such research areas as aging, women's health, and post-traumatic stress disorder. Lastly, the VHA manages the largest medical education and health professions training program in the U.S., and annually, the VHA trains about 83,000 health professionals. VistA, or the Veterans Health Information Systems and Technology Architecture, is the VHA's health information technology system. It is an enterprise-wide information system, and it used to create an electronic health record for each VHA patient. VistA has over a 20-year history of supporting healthcare in the Veterans Health Administration. It is a complete hospital information system which consists of the electronic health record, imaging, and barcode medication administration, among many other applications. Moreover, VistA has extended its use to other healthcare organizations in and outside the U.S. To begin to assess the business value of VistA and the relationship between IT investment and organizational revenue, the first step is choosing and collecting objective data that accurately evaluates the impact of VistA. The three variables we will need to look at are investment in VistA, or cost of VistA, use of VistA, and revenue expenditure of the VHA system. These variables will be measured by the information technology budget data for the VA, the total number of inpatient admissions plus outpatient visits in the VHA, and the total budget or cost of providing medical care in the VHA, respectively. This data was chosen because the information technology budget is a good estimate of the annual investment in VistA, and because the use of VistA can be measured by the total number of inpatient admissions and outpatient visits, since every time a patient enters a facility, their medical record is used. In regards to measuring VistA, the VHA does not earn revenue since the care is paid for by federal government. But if it were to earn revenue, then medical care cost budget data should equal the revenue of the VHA if it wants to break even and remain viable as a healthcare provider. The data were annual data, and the three longitudinal time periods were 2006, 2007, and 2008. Now, the second step of the process is verifying expected associations. IT investment, IT use, and organizational revenue must be highly correlated to indicate a strong association between the variables if return on investment is to be determined. For instance, if revenues can be attributed to IT investment, there must be a strong association between investment, use, and revenues. The third step is verifying causality of the relationship between IT investment and organizational revenue by testing whether IT investment has led to IT use and organizational revenue, meaning IT investment is the reason for growth in revenue, or test whether revenue has led to more IT investment and IT use, meaning revenue is a driving force. The last step is to calculate the rate of return to determine the return on investment. This step only occurs if the previously mentioned assumption, step 2, a strong association between the three variables, and step 3, IT investment leads to use and revenue, not the other way around, has been verified. These assumptions help to support the idea that IT investment is the reason for growth in revenue. Our sources of data for the analysis include the United States Department of Veterans Affairs 2008 Congressional Submission and the State Summary Fact Sheet from the Department of Veterans Affairs website. But before we could begin our analysis, the data representing IT use had to be calculated. From the VA website, we found the number of inpatient admissions for year 2004 and year 2005. From these two numbers, we forecasted the number of inpatient admissions to the year 2006 to 2008, and then we added the number of outpatient visits to inpatient admissions to get total IT use for each year. The top chart illustrates the forecast, and the bottom table displays the numerical data. This slide illustrates steps 2 and 3 that needed to be performed before determining return on investment. IT costs, which is investment in maintenance in IT. IT use, which is the number of inpatient admissions plus outpatient visits. And VHA expenditure, organizational revenue, is represented for 2006, 2007, and 2008 in the top table. Correlation coefficients calculated in Microsoft Excel are in the middle table. They show and confirm the necessary strong relationship between the three variables because the numbers are close to 1. Thus, the first assumption, step number 2, has been verified. However, in order to establish a causal link, the causation calculations needed to occur. The text at the bottom shows that the second model, highlighted in red, best explains the causality, which means that expenditures or even revenue is the driving force that leads to both IT costs or investment in IT use. This model best explains causality because it's closer to 0. Thus, this slide reveals that only one assumption was satisfied, and consequently, determining return on investment using the rate of return is not necessary. However, for the purposes of the presentation only, we will calculate the rate of return to determine the return on investment. To determine return on investment, we calculate the present value of the per year expenditure attributed to IT investment. We assume the interest rate of 5% and then sum the present value to get the net present value and to calculate return on investment. The results of the analysis revealed a rate of 2,574% return on IT investment. In short, our findings indicated that IT investment or investment in VistA may not lead to increased use and increased cost savings for the federal government because the second causality model proved to be the better model, and it states that organizational revenue is the driving factor behind VistA investment and use in VistA. In regards to limitations, the business valuation process was challenging because the data was annual, thus it was not as timely as quarterly data. Thus, our analysis was not as optimal as we would have wanted because the data was not as relevant. Also, it was challenging to select data that accurately and appropriately represented the investment, use, and revenue variables needed for analysis. Therefore, it was hard to ensure that data actually represented what we set out to measure, and that our conclusions regarding VistA and the results of analysis are valid. Overall, though, this project provided another opportunity to improve our data analysis skills as we learn new techniques in Microsoft Excel.